Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone, today we're going to talk about Hidrasec, also known as race-cadotril. This medicine helps us fight acute diarrhea, but how does it work? And when should we take it? Let's find out together. First, what is Hidrasec used for? This medicine is very effective in reducing diarrhea in both adults and children 3 months and older. It's often used when we have diarrhea from an infection or traveler's diarrhea. It can also be helpful in other cases where diarrhea is a major problem. So how does it work its magic? Hidrasec works by blocking an enzyme in our gut that produces more fluids, so it reduces the loss of water and electrolytes. Simply put, it helps control diarrhea without affecting how the gut moves. Now let's talk about how to take it. It's super important to follow the doctor's instructions, or the ones that come on the medicine packaging. For adults, the starting dose is usually 100 milligrams, 3 times a day. For children, the dose depends on their weight. Normally it's 1.5 milligrams per kilogram of weight, also 3 times a day. Don't forget that it should be taken before meal. As with any medication, there are some side effects that may occur. The most common are headache, nausea, or rash. If you notice anything strange or very strong, tell your doctor as soon as possible. And of course, never take Hidrasec if you are allergic to race-cadotril or any other ingredient in the medication. In short, Hidrasec is a very useful tool for diarrhea, but remember that it should be used carefully and under the supervision of a doctor. If you have any questions, always consult your doctor before you start taking. Take care and see you in the next video.
If you've made it this far, let us know in the comments why you're using this medicine.